Hey, good morning, everybody. I'm Emma Holly from Restore Therapy, and I'm delighted to have the opportunity today to talk to you about the Deep Oscillation tool, which I've been given the opportunity to trial from PhysioPod UK. So thanks very much, PhysioPod. Let's have a look at what's arrived. So first of all, came in this beautiful bag, and inside what we've got is the Journal of Manual Lymphatic Drainage, a little edit from there talking about the mechanisms of deep oscillation. So that will be something really great to be able to have in the clinic reception so that I can show to clients and talk to them about how it is the device helps. And then inside, the all-important bag containing the PhysioPod device deep oscillation tool. So the bag's really lightweight, certainly feels very robust and nicely packed. I feel like it's got lots of padding in there. I'm really fussy about not wanting to carry around heavy things, and obviously with my clinic in Harley Street I am trekking in and out of London, and so the idea of having quite a nice modestly sized device which is still going to be effective is really important to me. So let's have a look at what you get inside. So here we start off with, there's a little information booklet, frequently asked questions about the machine. And then this is it's going to be working on pulsing technology. So there's some little kind of electrode pads. We'll talk about those more in a minute. There's the all-important device. So this is the Pro version. Really nice, again, nice and light and neat. 10-hour battery life, you charge it up. You can't use it while it's charging, but with 10 hours, I think that's going to get most people through their clinic days without any problems. And then what's really important is that there's a little space, a bit like you have with a credit card, and it comes with a little card from PhysioPod, which has got your chip in it, and that obviously can be updated at any time, and it's got special programs loaded onto the machine. I've then got some gloves, because the exciting thing about this tool is that you can do therapy with your hands or using attachment. So it means that for me, with my scar work, I can still carry on and do a manual treatment, but at the same time have the stimulation of the deep oscillation tool, which is going to be really interesting to trial. The machine also has attachments. So we've got a very small head here. These are going to be attachments for which I can put larger heads on. Let's have a look in the other side of the bag. We shall zip that up. Here we go. We've got a great selection of more well packaged products which are going to be connected to the device. So obviously we need some leads. We've got some different size heads. So here's one I've opened, a large head. We've got also a smaller head, and then as I showed you before, I've got this very precise tool as well. So the head size on that is, I'm guessing a centimetre, but don't hold me to that. I'm sure it will say in the booklet. So I'm just going to set this up now. There we go. So I'm in now the final bit of setting up my machine. And here we now have the device. I've not yet turned it on. So to turn it on, really easy. Just press the button here. Lights up, as you can see. And then what I've then come to is like a kind of opening screen. And on this, it's going to give me some options. So it's already pre-loaded with some different things that you can treat. And what was a really nice surprise to me was quite how varied they were. We've got, starting off with the A's, it's in alphabetical order, Achilles tendon rupture. Then it's also got preloaded settings for cellulite, for fibromyalgia, for fibrosis, for hematoma. for ligament rupture, for liposuction, for low back pain, muscle stiffness. These are just a few. There's loads in here. Lymphoedema is a really important one that I know that they sell to a lot of people to home manage their lymphedema, as well as it's been used in the NHS. Never had any problems, and it's been really effectively treating lymphedema. But also good for things like muscle fibre rupture, pain, and there's pre-surgical treatment, and then also things like whiplash injury. So you scroll through using this little dial, and then you select the program that you want if you'd like to go with a program, but you can also just set your individual frequencies and timings to suit you. If you do decide to choose a program, what it will do is it will work on certain frequencies for a certain amount of time, and then it may change frequency depending on what the program is. And what happens when it changes frequency is that the sensation changes for the patient and for the therapist. So I'm just going to start a program now. And in order to get it to work, this works on a current system. So there needs to be a circuit. So there's this little kind of dumbbell thing. I hope you can see it. And if I'm going to be self-treating, I would hold the dumbbell, and then in this device head, I would then deliver the treatment. So when I put this on, I can hear a little buzzing. The minute I let go, the buzzing stops. It feels a little bit tingly. Not at all unpleasant. If very light touch just slides across the skin, and if somebody's got it has to be on dry skin. You can't use this with oil. If somebody's got quite damp skin, talcum powder would be used, or making sure that it's dried and cleaned before you start work, because obviously if there's loads of liquid on the skin, that's going to interrupt that current. You can choose the timing. You can turn up and down. If you find it too intense, you can turn down the intensity. And what it's doing is there's a little kind of suction action happening, and it's increasing that interstitial space. It's helping to penetrate deep into the body. The studies have shown that it goes up to 8 centimetres down into the tissues. And for the therapist, you just need to make contact with the tissues. You don't need to put pressure on. And then the other way that this device can work, I'll just get set up, give me a moment. So here we have some little electrodes. So this is the side, it's like got a little silver nodule on it, like a bit like a button or a popper. And then obviously like it's on some plastic because it's adhesive. So all I'm going to need to do is change my attachment lead, because I no longer want to use the self-treatment head, and what I'd like to do is to use the gloves and show you how that works. So I'm just going to stick this onto my arm, put over the I'm going to stick this here onto my arm, put over the attachment. Thank you, PhysioPod. Then I'm going to connect that. We still need to connect the dumbbell because we need the circuit. You'd always do this wearing gloves. You put on your gloves. And then this needs to be connected to the client. So you could either ask your client to hold it in their hand. You could put it between their toes if they don't mind, if it's kind of less sensation generally there. Some people probably wouldn't mind that at all. Some people might hate it, depending if they're freaked out by toe things. And then the minute I touch them, I would then be the device head. So rather than the pulsation coming through here, the pulsation is then coming through my hands. I only have to press very lightly, so then as I touch the patient, what I'm getting is a buzzy tingling through my fingers. It was a little bit strange at first, but really I treated my husband, obviously still in lockdown at the minute, having been sat at a desk all day. I just put it on to low back pain. He'd been quite stiff, and I just gave him the moves that I did were like very light effleurage moves, and I honestly, he can be really tight in his muscles, and I could feel the texture of them changing as I could glide through more easily as I went down through. I think I did a sort of 15 to 20 minute program on him, and at the end I really didn't want, you could then finish off with some oil massage, but I wanted to see how well it worked, and I asked him just to get up, and he was suitably impressed as well to how nice and free his back felt. Yes, and yesterday evening, having been on the computer all day, for myself, I had a go with it self-treating, working up my neck and shoulders. And when I then, normally I'm a little bit creaky in my neck after a long day at my desk, and when I was turning my head from side to side, there was noticeably less creaking. I've only had the device for a couple of days now, just started to play around with it. I will keep you updated as soon as I can get onto some scar tissue. I'm going to do a little update for how well scars respond to it. But thank you very much, PhysioPod, for the loan. Really enjoying the opportunity to do some reviewing with it and test out how it works. Thanks, take care everyone, have a good day.